Welcome, and we will wait just a minute or two for people to join the webinar. The numbers are starting to climb, and so let's be patient and we'll be starting in just a few minutes. Okay. We're still having people joining us, so we're waiting just a little bit longer. Looks like we've got a great participation today. Welcome. We're just so pleased to have you. Okay, it looks like our numbers are leveling off. So again, welcome to the 11th NIFA Nutrition Security webinar. My name is Helen Chipman, and I am the National Program Leader in the Nutrition Division of the Institute of Food Safety and Nutrition at the National Institute of Food and Agriculture, also known as NIFA. I will be moderating this session, which is titled EFNEP, a model of cooperation and collaboration, resulting in improved nutritional health and well-being of families with limited financial resources. EFNEP stands for the Expanded Food and Nutrition Education Program. We're excited to share about EFNEP because it is the nation's first federal nutrition education program for low-income populations, and it remains at the forefront of nutrition education efforts to reduce nutrition insecurity among low-income families and youth today. As we begin, let me share the U.S. Department of Agriculture's non-discrimination statement, which NIFA adheres to. Also, our programs and those who administer and receive the program are also expected to adhere to this non-discrimination statement. The link is in the chat. I'm going to give a short backdrop as to what NIFA is doing in the area of nutrition security for those who may be joining this webinar series for the first time. I am one member of a multidisciplinary NIFA nutrition security team, which has grown to more than 80 NIFA staff, and we have been working together since early 2021 to help address the Secretary's core priority of tackling food and nutrition insecurity. To prioritize nutrition security, NIFA has invested more than $200 million in research, education, and extension, and innovation through 5 key programs. The Expanded Food Nutrition Education Program, which we will focus on today, the Gus Schumacher Nutrition Incentive Program, Food and Ag Service Learning Program, Community Foods Projects Program, Agriculture and Food Research Initiative, Competitive Grants Program Priority Area A1344, which is the Diet, Nutrition, and Prevention of Chronic Disease Program Area Priority. We are also leveraging more than 20 other programs that are listed here. This integrated approach positions NIFA well in addressing food and nutrition security research gaps and mobilizing our broad and committed stakeholders through education and extension to help build awareness around how to prioritize nutrition security at the local, state, tribal, and national levels. This slide shows some of the webinars that have been held over the past year or so. We are also actively updating and bolstering our new Food and Nutrition Security web topics page, and we are creating additional subtopic pages, so we invite you to check back periodically for updates. For today's webinar, we will begin with an overview of EFNEP, and then the panel members will highlight the power of cooperation and collaboration as they give examples of how EFNEP is working with others, both internally across EFNEP and externally with others who also are engaged in this space, whether it be programmatically, through research, and in other ways. Cooperation and collaboration has been critical to EFNEP's success for more than half a century. We will then have a brief question and answer period, and I will highlight the next webinar, and we will finish with an optional breakout session. We want to make sure that we give you some time so that you can further discuss and learn from one another what is possible for advancing nutrition security through cooperation and collaboration with both known as well as new potential partners. And because the Q&A period will be perhaps fairly short, what we would do is invite you to indicate in the Zoom function of Q&A function to list your question and indicate your name and your contact information so that if we do not get back to you during the webinar, we can follow up later. Now, throughout the webinar, we want to engage you as our participants. As you feel comfortable, we invite you to actively participate in sharing your name in the chat, in answering polling questions in the chat, in raising questions in the Zoom question function that I just described, and then in participating in the optional breakout groups that we will provide details more about at the end of the panel presentation. So we're going to start with a couple of polling questions to just help us get to know each other in this virtual space. Oh, I'm ahead of myself, excuse me. So the first question is, with respect to your role in terms of nutrition security, and you can put this in the chat, are you at the local level of program development, at the regional or state level of program development and implementation, I should say? Are you a national or federal level program, providing national level program oversight? Are you conducting research? Are you teaching, whether it be a college, a university, or in some other fashion? Or are you involved in some other way? So I'll give you just a minute or two to respond to the chat. It's one of the things virtually, it's just nice to get to know one another, even when we can't sit together at the same table. We can still become familiar with where we're coming from and learn a little bit about each other. Thank you for participating. Okay, as those continue to come in, I'm going to go ahead to the second question. And this is meant to be kind of a fun question, a little bit of something we might learn about each other. Given that this webinar series is about nutrition security, what is one of your favorite healthy summer foods? Give you a minute to think about that one. It's a great time of year to think about foods because there's so much fresh and produce or other foods that I always love the summertime and the foods that are available. Okay, as you're continuing to share a little bit about yourselves, I will share a little bit about our panel members, and we'll start with myself. As I noted earlier, I'm a national program leader for food and nutrition education at the National Institute of Food and Agriculture, or NIFA, which is within the U.S. Department of Agriculture. My emphasis is on low-income nutrition education, and so I administer the Expanded Food and Nutrition Education Program. I liaison with Food and Nutrition Service, FNS, as well as other partners on the Supplemental Nutrition Assistance Program Education, also known as SNAP-Ed, and I support agency nutrition security efforts. Over the past 2 years, I also led several competitive grant programs and served as an acting divisions director for NIFA. Working with others, I have led the development and implementation of a socio-ecological framework for nutrition education, a national online program monitoring, evaluation, and reporting system, and multi-level staff core competencies. With FNS, I co-led a program implementation research on SNAP-Ed and EFNEP around policy systems and environmental change. I also oversee data aggregation and national reporting for EFNEP. Prior to my federal appointment, I had similar responsibilities in administration, teaching, research, and extension as an extension specialist and professor at South Dakota State University. And then finally, a personal priority that I've had throughout my career has been a goal to always foster shared understanding across organizations, systems, and structures. Now I would like to introduce you to our EFNEP coordinator, Dr. Carinthia Cherry. As you will learn today, she provides day-to-day programmatic leadership of EFNEP and works closely with program implementation across the United States. Carinthia, would you like to tell us a little bit more about yourself?
Sure, Helen. I'll just add that prior to coming to NIFA, just about 1.5 years ago, or so now. I work with Extension as a nutrition specialist at North Carolina A&T State University. And I also previously worked as a WIC nutritionist in rural North Carolina. My passion lies within the community nutrition arena, and I'm glad to be a part of NIFA and share with you today about EFNEP and our collaboration and cooperation. Thank you.
Thank you, Carinthia. Also on today's panel is Ms. Catalina Aragón, and Catalina provides statewide leadership and support for EFNEP and SNAP-Ed through Washington State University. She is also actively involved in a multi-state research group that she will talk about a little bit later as part of her presentation. Catalina, what else would you like us to know?
Hi, everyone. My journey with EFNEP and SNAP-Ed actually started as a graduate student in Clemson University in 2010. So it's been over 10 years working with federal nutrition programs. And it's been such an amazing journey, and it's really been amazing for my career to have that connection to the community, but also being able to work on research.
Thank you, Catalina. We also have Ms. Shewana McSwain, who has been serving as an interim EFNEP coordinator and as a SNAP-Ed coordinator at North Carolina A&T State University. She has more than 6 years of experience with youth and adult program development, 2 of those years including organizing and managing 4-H camps. Shewana, what else would you like to add?
Hello, everyone. I have been with Extension ever since I graduated college. So telling my age, but almost over 20 years. And I love it. I love working with the communities. I love working with the specialists. I love working with the agents. And I truly have enjoyed my time with EFNEP and just working with limited resource families and seeing them make the changes they need to live a healthier life. Thank you.
Appreciate that. So this is our panel that will be speaking today, and we'll jump right in. EFNEP is one of the NIFA's signature nutrition security programs, and some of you know this program very well. Others may have heard about EFNEP on a high level, and some of you may have never heard of it until today. So to get us all on the same page, this deep dive will cover EFNEP's placement within government, funding, history, defining characteristics, implementation, and impacts. As I shared earlier, EFNEP is the nation's first federal nutrition education program for low-income populations, and it has helped people make change in their lives to improve their nutritional health and well-being for more than half a century. Importantly, as with any program, we have not done this alone. So as we talk about nutrition education, we first need to understand what we mean. And if you ask different people, you may get a variety of different responses depending on who you talk to. For EFNEP, we embrace the definition commonly used in the professional nutrition community, which is any combination of educational strategies accompanied by environmental supports designed to motivate and facilitate voluntary adoption of food choices and other food and nutrition related behaviors that are conducive to health and well-being. It can be delivered through multiple venues and involves activities at the individual, community, and policy levels. It addresses critical issues such as food and nutrition security that we are discussing today, food scarcity, food literacy, food sustainability. So as you can see, this definition is much broader and more comprehensive than some may have initially envisioned. So where is EFNEP's placement within the government? And where does funding come from? Understanding the funding is important because it helps explain why a program can or cannot do certain things, what the funding authorities allow, what the mission areas allow. EFNEP is congressionally funded and it's administered by the National Institute of Food and Agriculture, and NIFA is an agency within the Research, Economics, and Mission, or Research, Education, and Economics mission area of the U.S. Department of Agriculture. And what I want to point out on this organizational chart is that these missionaries are distinct, and many of you may be familiar with the food nutrition services, nutrition programs, for example, SNAP, WIC, child nutrition programs, food distribution program. And as you can see, all of those programs fall under a different mission area within USDA. So they are complementary, and yet they are distinct from EFNEP, and they have a different mission. Within FNS and NIFA, we meet regularly to share and coordinate in areas where our mission areas align, while also being mindful of the intent of our respective funding authorities, as we need to always stay true to the intent of the legislation. Now I'm going to turn more specifically to, on a few more points about EFNEP. Funding, as I said, began back in 1969, which interestingly was the same year that the first White House Conference on Food, Nutrition, and Health was held. And now we're having our second such conference. Current funding is $70 million per year. And EFNEP's purpose, as determined by legislation, is to help low-income families and youth learn skills and behaviors to improve their diets and nutritional well-being using a paraprofessional or peer educator model. EFNEP is funded as a capacity grant to cooperative extension within the 1862 and 1890 institutions. And that may sound like jargon to some of you, but what it means is that funding is distributed to specific institutions according to a legislatively defined formula. EFNEP is a results-based program. Data is used to help participants set goals and experience success. Data is also used to set program priorities, monitor and improve programming, and ensure program and fiscal accountability at the local, state, and federal level. I've always been impressed how evaluation has been a foundational component of EFNEP, even at its inception. The formula for funding is complex. At a high level, it is based on census state poverty data. Another aspect of EFNEP is that it is 100% extension programming. So any supporting research needs to come from other funding sources. And Catalina will be speaking to some of that later in our presentation. When EFNEP began back in 1969, it was the only federal nutrition education program. And I emphasize that because at that time, it was even then critically important that there was coordination, cooperation, that there was working with others in order to reach the target population. It was essential that the program was nested in the community, critical that the people who did the program knew others, and they found ways to get in the door, so to speak. That was critical to finding a population and delivering this program to help people in their lives. Over time, as we know, many of us, other entities have also become involved in this space of education and such. And SNAP-Ed, as an example, is celebrating its 30th anniversary. That is something we all should celebrate. As for my own history, early in my career as a state EFNEP coordinator, I was able to work with colleagues from what at the time were the state agencies leading and others leading the food stamp program, WIC, the food distribution program for Indian reservations or FDPIR, school meals, team nutrition and aging. And we worked collaboratively, even though there was no mandated or dedicated funding to support our efforts. And it was through the example of these individuals early in my career that I learned that collectively, we were better able to serve the population in our state, as well as to receive funding for specific projects. Two examples of funding that came as a result of such efforts were several multi-year projects with the food distribution program for Indian reservations, and the initiation of what we now know as SNAP-Ed. Carinthia, at this point, can I turn it to you to give us your perspective from your lens of what EFNEP is about from the national level?
Sure. Thank you, Helen, for that foundational information. So we'll start with some distinctive characteristics of EFNEP. And although these are unique, they may be shared with other organizations as well. And some of these characteristics are legislatively mandated, including the peer educator or that paraprofessional model. And that's how we deliver our programming. Others of these characteristics, including that last bullet, highlights a commitment to cooperation, coordination, and collaboration. And these are program policies and core values of the EFNEP program. We also like to emphasize learning over time. And this gives participants the opportunity to practice or implement what they've learned. So just a few of those distinctive characteristics, not unique to EFNEP, but can be shared with other organizations. Next slide, please, Helen. So I'd also like to lift up a few factors that contribute to EFNEP's success. EFNEP is nested in communities, the community of cooperative extension, the land grant community. We know that for the greatest effect, nutrition education involves a social ecological approach, and that draws upon the collective strengths and contributions of individuals, families, organizations, and other sectors of society. We need to work synergistically across programs. And in recent years, we've really been impressed with the progress that we've seen at some of our kind of site visits for our EFNEP programs. And what we've seen is that these communities are coming together to align their program efforts across programs, again, strengthening our impacts. A second contributing factor is the content and methods that we utilize are grounded in research, such as the dietary and physical activity guidelines. Our content also supports change, and it helps our participants learn what they need to do in their specific situations. And this means that we're able to meet individuals where they are. Another factor is that EFNEP values the lived experience of not only our peer educators, but those that they teach. Our programming is learner-centered, culturally relevant, and it's dynamic. And lastly, evaluation is integral to programming. It allows us to celebrate the success, determine where we might need to give greater focus, and inform new directions. Next slide. Thank you. So who do we reach at EFNEP? EFNEP is available in all 50 states, in 6 territories or insular locations, and the District of Columbia. The universities themselves are responsible for determining where program happens in their respective locations. And they base that on need, capacity, and resources that are available to them. As I highlighted before, EFNEP reaches people where they are, whether that's in their homes or their other community environments. Roughly 80% of our adult participants are at or below the federal poverty line, and most of the rest are at less than 185% of poverty. More than 70% of our adult participants are also people of color or are of Hispanic ethnicity. And following national trends over the past decade, we've also seen an increase in programming to refugee and immigrant populations. So EFNEP has a broad reach that continues to expand. Here, I just want to show you some of our 2021 program highlights. In general, routinely, more than 90% of adults report improvements in their diet as they participate in EFNEP. They also increase physical activity and gain food resource management skills. Some of those skills include improved shopping, cooking, and other food-related behaviors. EFNEP also contributes to workforce development of historically marginalized and underserved populations. We all face challenges in terms of the coronavirus pandemic in FY21, but despite those challenges, EFNEP saw a continuation of effectiveness in leading to change behaviors. So in addition to that quantitative data that we track, we also collect qualitative data on EFNEP's impact. We receive impacts reflecting individual and family changes, as well as organizational and community changes. Here, we're just sharing an example from 2021. And this is it talks to us about an individual new to this country who learned to eat new foods, increase her buying power, and also make healthier food choices. This example also shows how EFNEP works with and collaborates with others in the community. In this case, the collaboration was with an adult learning center that helped individuals learn English. And as I speak of EFNEP, I always like to underscore the individuals at the state and the local level. They are critical to the program's success. I want to recognize them, and a lot of them are here with us today, and all those others that are at the forefront of the important work related to nutrition security. So as we move on to today's focus, we're focusing and going to talk a little bit about cooperation, coordination, and collaboration. We'll provide a few examples of how EFNEP has worked internally as well as externally with others beyond EFNEP to leverage success. EFNEP operates under that umbrella of that federal and university partnership. And through this partnership, we're able to accomplish so much more, again, working synergistically together. And we appreciate the volunteer efforts of our university program staff. They contribute to national teams, and that's things like being a part of working groups, and they help us to inform and enhance our policy, such as technology policy. We know that technology is changing, and they've been integral in helping us kind of develop that policy. They also work as a part of planning committees. One thing that I love about our EFNEP is that we always are promoting the sharing of those resources that are developed. And again, that federal university partnership is critical to success. And so with that, I'm going to turn it over to one of our university partners who is joining us today, and she'll share a few more examples with us. So I'll give it over to you, Shewana.
Thank you. So as mentioned previously, EFNEP is the nation's first nutrition education program for low-income populations and remains at the forefront. EFNEP is run through the cooperative extension land-grant institutions, pulling on the strengths of the 1862, 1890s, and insular universities. In EFNEP, building strong partnerships allows us to more effectively serve families. Our strengths are being able to work within the communities with our peer educators, acting as mentors to the families that are enrolled in EFNEP. The peer educators build trust and develop relationships with the families through our series of classes. Because of these relationships and our interactive classes, families begin making the recommended changes to lead healthier lives. In North Carolina, as in many states, there are two land-grant universities, North Carolina A&T State University and NC State. EFNEP at North Carolina A&T State University has always had a strong partnership with NC State's EFNEP program. The coordinators meet monthly to discuss growth and development areas and any challenges the programs are facing. By working synergistically, we are able to ensure that our EFNEP reach is seen in all 100 North Carolina counties. And I saw Lisa on here today, and so I just want to thank her for joining and supporting this webinar. Before COVID, NCA&T EFNEP partnered with Virginia Tech to be trained on their Lifetime Improvement Through Fitness Together, or LIFT program. This program quickly became popular for EFNEP educators and FCS agents to conduct together. The EFNEP educator would focus on the importance of nutrition, using Eating Smart, Moving More, and encouraging their participants to consume more fruits and vegetables. The FCS agent would lead the exercise portion of the class. During COVID, LIFT became a sought-after program. The LIFT program impacts and outcomes have been outstanding, with 95% of participants increasing lower and upper body strength and 87% increasing the consumption of fruits and vegetables. Now I'll turn it over to Catalina to share what has been impactful in her EFNEP region.
Thank you, Shewana. I will be sharing an example of internal cooperation and collaboration, in this case, EFNEP cooperation within the Western region. I did notice some of my Western region EFNEP colleagues joining the webinar, and if you're comfortable, I would like to invite you to share on the chat box your institution and your involvement with Western region EFNEP. As the name suggests, the Western region encompasses the Western states, including Hawaii and Alaska, and the U.S. territories in the Pacific. And this means our monthly meetings happen across 6 different time zones. We start at noon in Hawaii, 2 p.m. Alaska, 3 Pacific, 4 Mountain, 5 Central, and actually the next day morning for colleagues in Guam. In these monthly meetings, they're 1 hour long, and we spend most of the time sharing what is going on with our programs, and it provides a great opportunity for problem solving and resource sharing. For example, a few, I think months ago, I was working on in-person guidelines for activities in Washington State University EFNEP. And during this call, I reach out to my colleagues and say, hey, do you guys have guidelines as your state reopenings on what our program looks feet on the ground? And immediately my email was overwhelmed with my colleagues sharing what they're doing on their state. And this made my job a lot easier. In addition to our monthly meeting, we also have a listserv, and we use this listserv to support each other. And sometimes, again, it's asking for resources or advice, sharing notice of vacancies. It's a fantastic open line of communication. And we also meet in person twice a year, once as part of our Western region meeting when one of our states hosts a meeting, but also during our national EFNEP meeting, we have some time together as a breakout sessions. These meetings were face-to-face. Recently, they've moved to Zoom, but hopefully in the future, we will go back to face-to-face. Next slide, please. Thank you. Another example of regional collaboration is reflected in our EFNEP 5-year plans. And the 5-year plan is one of EFNEP requirements, and it's a strategic plan of what needs to be accomplished in the next 5 years of programming. The Western region worked together to identify a shared regional goal. And these slides show youth participation in the Western region as of federal fiscal year 19 and the national goal. As you can see, the Western region was focused on K-5 younger youth. So we identify as a goal to start working towards reaching more older youth from 6th grade to 12th grade. Next slide, please. This is what our regional goal looks specifically for my institution at Washington State University. And as you can see, we're moving towards reaching more older youth. It's been a little bit bumpy because of COVID, but we're moving towards our objective. And here it breaks down the youth participation in the Western region as of federal fiscal year 19 and the national goal. Again, the focus of youth participation favored younger youth. And as a region, we're leading the nation in moving towards the national goal. And we've seen an 8% increase in older youth within 2 years. And again, with all the humps and bumps we've had to navigate because of COVID. I am now going to switch gears and talk about external partnerships. And again, I did see some of my NC 3169 colleagues on the chat box, and also former NC 31, NC 21, and NC 1169 members. So if you want to type on the chat box, I want to invite you to share what your involvement with NC 3169 has been. Before I go into what all these means, I do want to highlight that EFNEP funds cannot be used for research. However, EFNEP is embedded in the land-grant university system, and this provides a unique opportunity for developing, testing, and implementing research-based outreach and educational interventions. So that's how the Agricultural Experiment Research Multi-State Research Group NC 3169 EFNEP-related research program evaluation and outreach comes into play. It's a very long name, and when I see my colleagues sharing, we have Susan from Colorado State University, Imelda with the impact statements, and Nicole is there. It's really takes a village. Thank you all for sharing. And NC 3169 integrates research, extension, and education through multidisciplinary efforts to develop research-based evaluations and resources for EFNEP to use nationally. Our group membership is very diverse. We have researchers, we have practitioners, graduate students. We all have different backgrounds and trainings. Right now, I think we have professionals. Oh, Teresa, hi. Teresa's also part of our NC 3169 group. And as I was saying, we have backgrounds in nutrition, dietetics, family and consumer science, psychology, public health, statistics, and economics. We complement each other very well. We have membership across all 4 NEFA regions, and we have representation of both 1862 and 1890 land-grant universities and institutions. And we have also had other institutions joining us for specific projects as well. We also have students, early career researchers, and seasoned, well-established faculty. Okay. 8 years of Remain has also been part, actually from its inception in 1169. So NC 3169 started in 2008. Disclaimer, I was not part of EFNEP at this time. And NC 1169 was approved for a 5-year cycle. And that work needed to be continued, so it got reapproved for another 5-year cycle at NC 2169. And right now, we're currently in the 3rd 5-year cycle with 3169, and we're having conversations about a potential NC 4169 renewal. When NC 1169 started, the question that they were hoping to answer was, what are the best methods for measuring the dietary intakes and related behavior of EFNEP participants? This work has continued over almost a 15-year span now, and we currently have a membership of 24 researchers, practitioners, and graduate students. To me, what the story this tells is how team collaboration can lead to success beyond what can be accomplished individually. And this includes the ability to integrate research and teaching in extension programming. And this work has been evidenced to be sustainable and can continue beyond the initial efforts. Some of the key contributions from 3169 are the development and validation of the Food and Physical Activity Questionnaire. And this is a questionnaire that encompasses questions on physical activity, nutrition, food resource management, and food safety. We're currently working towards developing a Spanish translation that is valid. We've also done some work on quality of life impacts on participants and educators and improvements in dietary intake methods. And this is one of my favorite slides of the presentation. All the states highlighted in pink have been involved in NC 3169 in the development and testing of the Food and Physical Activity Questionnaire. The involvement may or may not be by having a member who's actively involved in this group, but we rely a lot on our colleagues to reach populations and connect with EFNEP audiences to make sure that we're developing tools that can be used nationwide. NC 3169 has coordinated all of this work with one goal: strengthening EFNEP's future. And the story this slide tells me is it really takes a village and common long-term vision, administrative commitment, federal support, but ultimately commitment by people who care about the communities that they serve. This summarizes the outcomes from NC 3169. These are limited to this third iteration of a 5-year project. My apologies. And both NC 1169 and NC 2169 have also been very productive in all 3 domains: research, extension, and teaching. Next slide, please. And finally, this is a picture of our group in our last in-person face-to-face meeting. This happened in 2019 in New Jersey. And after that, we've been moving to an in-person Zoom format. I do want to put a plug if you're interested about this work. Thank you, Sheila, for sharing the link on the chat box. But we're always looking for new members. One of the key successes of our team has been integrating different expertise and backgrounds into the work that we do and leverage those expertise. So if you're a researcher or a practitioner or a teaching faculty, we want you in our team, and please do contact me if you're interested in learning more about what we do and how you can join our efforts. That concludes my part of the presentation. Back to you, Shewana.
Thank you. I'm going to talk a little bit more about the partnerships we have at North Carolina A&T State University. I'm always seeking out new partnerships, and I was introduced to WellCare. And WellCare is a health insurance company that provides managed care services primarily through Medicaid and Medicare. They also offer outreach programs to their clients and have 4 welcome rooms across North Carolina. Because WellCare and EFNEP work with limited resource families, although different in different areas, our discussion led us to a partnership. In the welcome rooms, EFNEP educators would be allowed to conduct nutritional classes. WellCare would also refer their clients to these classes. The connection is that for every $1 spent on the adult EFNEP program, it produces a benefit equivalent to $10.60 in healthcare savings. Next slide, please. Table for Two is a North Carolina A&T EFNEP curriculum for limited resource pregnant women. To ensure our outreach was maximized, we sought out partners who already worked with these women. A strong partnership was developed with Nurse Family Partnership, a home visitation program that provided services to pregnant women who were 28 weeks or less with their first baby. This partnership has been ongoing for 4 years. These are sessions that are conducted by one-on-one, and they have very strong outcomes, such as women breastfeeding for at least 6 months, increased fruits and vegetable consumption, increased food security, and decreased low birth weight babies from participants enrolled in the program. We also partnered with Room at the Inn, a licensed shelter for homeless women in Greensboro, North Carolina. Educators go into the shelter and provide 9 Table for Two classes. This partnership has been ongoing for 6 years. A local Rotary Club also heard about Table for Two and wanted to provide support to the participants and to the educators. When participants graduate, they now receive pack and plays, books, bathtubs, diapers, and baby clothes. The Rotary Club also provides educators supplies for food demonstrations. Next slide, please. The slide above has some pictures of EFNEP in action. EFNEP makes partnerships to provide lived experiences, which makes the connections to nourish healthy families. Working together through university and community partnerships leads to decreased chronic disease throughout North Carolina. And now I'm passing it back to you, Helen.
Thank you. So I'm going to talk about these partnerships at the federal level as well. Sometimes we get requests to work with a certain national priority, or just there's so many things, because EFNEP is connected to communities, that people would like to work with and through EFNEP to accomplish their objectives. And so we always have to be careful when we get those requests to make sure that they align with what EFNEP can do through its legislative mandate. And one example that I can lift up here is the Cooperative Extension System's National Framework for Health Equity and Wellbeing. Earlier this year, I believe it was, there was a webinar in the Nutrition Security webinar series where this webinar, or excuse me, where this framework was discussed, and you might go to that webinar and learn more. For today, what I'm going to share about is this relationship. NIFA has entered into had a memorandum of understanding and is committed to helping to facilitate and encourage that this framework is understood and it's embraced. And so then programmatically within EFNEP, we're looking at, so what does that mean for EFNEP? Where and how would EFNEP fit in to helping support this effort that's happening across all of cooperative extension? And as you look at the 5 priorities that have been identified, there's 2 that stand out right away. One, advancing health equity and establishing partnerships. And so this is an area where we at the federal level will be looking at what is happening and what the possibilities are, making sure that we also stay within our nutrition education bandwidth. At this point, I want to share with you, for more information, there's I'm listing several hyperlinks that you can go to about EFNEP, about extension.org, and about NIFA, because we've covered a lot today and there's so much more that we could learn. I would also say that whenever I want to work with others in terms of a partnership, I do the very same thing about that organization. I want to learn what I can about where they're coming from so I can see where whether alignment may be possible. Also, if you want to follow up with any of our speakers today, here's their contact information. I will point out that Catalina is only with us until September 15th. So if you want to reach out to her, you'll need to do so before the 15th, and then she'll be happy to speak with you. We actually have a little bit of time for questions and answers. Dr. Stephanie Morris is going to be handling our Q&A, and I think we have about maybe 10 minutes that if there have been questions coming into the chat or even comments, we'd sure like to hear them. I first want to thank each of our speakers. I always learn something when I am on these panels or in an audience and listening to others. And so thank you for what you've provided. And I hope that we as a group have also perhaps provided some nuggets or some thoughts that maybe trigger some new ideas for you who are participating, whether it was something we said or whether it was something altogether different, but it still was a trigger for a new idea. That is our hope in terms of what you can do and how you can be successful as you work with others to further enhance the work that you're trying to accomplish. So in terms of the questions, again, I think we have about 10 minutes. And then at that point, what we'll do is I will speak about what's coming up within regards to the webinar series. And then we will give the breakout information. We want to make sure we have enough information for the breakout, but we're also very pleased that we have some time for Q&A. So Stephanie, do you have any questions for any members of the panel?
Yeah, we've got a few questions that came in. The first is Hope Friedman asked whether the slides will be shared after this meeting, and we answered that with pointing towards the Nutrition Security webinar series. This meeting is being recorded and will be posted to the NIFA website once it's accessible and compliant. For our panelists, we have, I believe these are for Shewana, we have questions. Is there table for 2 curriculum that we can have access to from Sarah Jurgensen? And also on Table for 2, Barbara Sachs has asked, is Table for 2 a Rotary program or is there another entity implementing it? And is it something that a local cooperative extension can do in their county?
So Table for 2 is specifically designed for EFNEP educators to work with limited resource pregnant women. It's not run through the Rotary Club. It is run through North Carolina Cooperative Extension and partnered with both A&T and NC State. The Rotary Club heard about Table for 2. I'm not sure. I know that the counties advertise it, so maybe they saw it that way. And they just wanted to partner with us. I think they read the first 1,000 days and they saw the connection between that book and the Table for 2 program. And they wanted to do more for the ladies. And so that's where it came up that they would provide the pack and plays. They would help with food demonstrations. And they've even come to attend a couple of classes and tried to work with Room at the End to create a mentorship program as well. As of right now, it's only Table for Two is only offered in North Carolina. I'm currently working on updating the version, updating Table for Two, and maybe after it's been updated and it's been pilot tested in North Carolina for several years, so it is proven to work and make strong impacts, then it'll be able to be used across the United States. I think I answered all the questions.
If I could add something that is kind of a follow-up to that. Within EFNEP, we have limitations on how we can spend funding. And so I think as Shewana gave in this example, through partnering with others, we're able to leverage and to be able to do things with funds that we cannot do with EFNEP. That's one of the nice things about having partnerships, is that what you cannot do because of certain legislation and what your funding supports, others may be able to do to help further build out or leverage or augment or make your program more available. Now, the flip side of that is, as probably all of us or many of us know, is that whenever you enter into a partnership, you have to find that common ground that works for both entities. And so that can be a limiting factor in some cases where, I'll give an example. Sometimes people will want to partner with an organization that wants to work with all people, and EFNEP is very much about working with this low-income population, families and young children. And if it's a different population, then that becomes a little bit problematic, and we have to think through, is there a way that we can meet a common goal there or find a common audience? Turning it back to you, Stephanie.
Thank you. Continuing the theme of partnerships, we have a question in the Q&A. How do community organizations who would like to organize EFNEP education for their participants build these partnerships?
So all EFNEP coordinators and educators are opening to partnering as long as it falls within our guidelines, as Dr. Chipman just mentioned. You just have to reach out to either the coordinator or different states are structured different ways. So it could be a coordinator, it could be a regional manager. The good way to find out is to go to the Cooperative Extension's webpage and to go under EFNEP and see how to contact the individual notified there. But we're always opening to partnering. It helps us expand our reach. And the participants really love it when we come together. So, that's my suggestion, is to go through the Cooperative Extension website to find the EFNEP coordinator or the designated person.
Catalina, would you have anything to add as a state coordinator?
I echo what Shewana shared. I also think having the educators' feet on the ground, identifying partners and sharing what they see when they're in the community is also very helpful to identify potential new partnerships. We do have constraints on who we can serve. So also being mindful on these community partners, who are they reaching and how they overlap with the EFNEP mission.
One thing I might add, and maybe Carinthia, you spoke about this a little bit earlier, or you could add. In fact, maybe you could share a little bit about what's happening with regards to technology in EFNEP and how that might be a factor here.
Sure. So one of the things that came out of the pandemic, but also that was being addressed prior to that, was that there was a kind of a shift in how we might deliver programming in some areas. So we still follow our traditional face-to-face model, but technology, we know, is not going away, and the need to be able to adapt and have some virtual delivery is going to be continued. So one of the things that we did, we had a working group that consisted of EFNEP educators, or EFNEP coordinators, from across the country. And they came together for about a year or so, and they helped to kind of develop a technology plan. And so it had things related to what does that face-to-face delivery look like in terms of percentages, and how do we compare that to make sure that if we need to adapt or move to a virtual format. And it also have considerations related to safety, especially when we're talking about our youth population. So safety, also access in terms of 508 compliance, and making sure that the materials that we provide are accessible and available to all. So those are just some of the ways that we think about how we can partner with our, we've had to partner a little bit differently, specifically around our schools. That was a huge partner for EFNEP. And now we have to look at how we can continue those partnerships, but continue them differently. Anything else you would add, Helen?
I know, just to share, I think that where we were geographically constrained in the past may not be quite as much so, again, depending, as was said earlier, the needs, the capacity, and the resources that the institution has available. So if you're interested in developing partnerships with EFNEP, definitely reach out.
Thank you. We have one more question in the Q&A. This is from Lori Klein, who asks, is there a reference source available for the $1 in EFNEP spending equaling $10 in healthcare savings?
It is. It's actually several research items in research that has been done. I can share the link. I think Virginia Tech conducted the first research, and then there's been several people who have redone that, but I'll try to put it in the chat box real quick.
I believe you can also look on the About EFNEP webpage, and there's some resource links as well as far as some of the studies that have been done over the years, looking at a cost-benefit analysis. Some of them are some of them aren't quite as recent, but because they haven't been replicated. But that's where some of this is coming from as well. And it's certainly, I think, with the NC 3169, it's been a constant point of conversation. Am I wrong on that one, Catalina?
No, the work we do in NC 3169 has three, I'm going to call them subgroups. Cost benefit analysis is one of those subgroups, and there's a couple of projects this subgroup is working on. I also added the link on the chat box. If you scroll down that webpage, there is the list of the previous cost benefit analysis that have been published.
Thank you. And thank you, Stephanie. So this worked out perfectly. We will now share about the next webinar that's coming up. It's in August 30th. And the title, as you can see, is Promising New Measures. We can't read it, actually. Promising to access aspects of food nutrition security, insecurity experience. The speakers will be Eric Calloway, Leah Carpenter, Tony Gargano, Julia Sharp, and Amy Eric. So we encourage you to participate in that if it's of interest and if you can. And then as well, and there will be a registration link circulated soon. We also want to lift up that soon we'll have another webinar, and that will be focused on the Nutrition 4-H Conference, Nutrition Security Youth Roundtable findings, which were on how to elevate the youth voice in promising and elevating nutrition security. And they're definitely a very important voice in the future of how we're going to deal with this very important issue. And with that, I think we are to the point where we will go into these optional breakout discussions. So we will be leaving the Zoom webinar link. We have to leave this link, and then we will transition to the breakout group using the new link that is found here and in the chat box. And then what we'll have the nutrition or the NIFA webinar team that will help us make that transition as needed. And each of the panel members will be in the breakout rooms to have further conversation with you. We look forward to seeing you, and especially we just want to thank you for your time and attention today. Love to hear from you as well. Thank you.